Starting the recording. Okay, hello. This is our group. We got me, Kellen Foster. We have, y'all can introduce yourselves. Go ahead, please.
I'm Rachel
Uh,
Reeser.
Trang Nemeth.
Okay, wonderful. We're going to be completing our QEP debriefing questions. We completed the clinical project together, and now we are going to be completing the debriefing questions. So I'm going to be sharing my screen now, and it'll be showing the questions. So let me go share, and it's the debriefing questions. Share. Okay. Are y'all guys able to see my screen?
Yes.
Okay, wonderful. So before I turn this in, I'll be sure to fill this out and put in our names and all that. But we'll go ahead and run through the instructions real quick. So the instructions are enter your group members' names and date on the template, indicate who the group leader is on the roster above. They've indicated that they want me to be the group leader, so that's what we'll do. We'll answer the questions as specifically as possible. This will be done as a recorded discussion over Zoom, okay, which we are doing. You state each question and proceed to discuss in your groups. Note if they're unable to attend, okay, that's impertinent to us because everyone is in attendance. Submit one recorded Zoom session to Canvas, and I will do that. This conversations take about 30 to 40 minutes. Okay, sounds good. Each person's responses should be specific and address the questions thoroughly. Save your recorded Zoom link and attach this form. Submit this form to Canvas so we can retrieve the Zoom link. Okay, this part of the clinical activity is worth 40 points. All right. Debriefing purpose. Did y'all guys want to read it, or I'll read it? I don't mind. I just don't want to bore y'all too much.
Yeah, you can read it, Kellen. Good job. Keep
Yes,
going.
ma'am. Sounds good. Okay. So debriefing purpose. The purpose of this case scenario simulation debriefing is to examine and analyze the group's reflections and experience for this real-world clinical activity. Clinical activity purpose. The purpose of this real-world case scenario simulation is to examine and analyze the patient scenario with a focus on providing safe, quality, and effective patient care as a professional nurse. Students will identify, construct, and evaluate effective care strategies that promote problem solving in a safe environment for patients and staff. Objectives. Construct clearly identified problem statements based on the facts from the clinical scenario. 2. Examine patient-centered strategies and approaches that demonstrate competence as coordinator of care, caring, and safe behaviors, cultural awareness/diversity, and advocacy for patient, family, and self as a nursing professional. 3. Engage as a member of the interprofessional healthcare team through identifying scope of practice, effective communication techniques, collaboration with patient/family, reflect on communication style, and utilizing best practices as solutions for the problems identified in the clinical scenario. 4. Evaluate best practices to ensure a caring and safe environment for patients and colleagues related to the problems identified in the clinical scenario. 5. Demonstrate KSAs associated with providing safe, quality, and effective care using PDCA or RCA, appropriate care interventions that ensure best practice and cost containment. 6. Demonstrates KSAs to ensure safety for the patient and healthcare environment, reduce the risk of harm, and perform legally and ethically. 7. Utilize informatics and technology to protect patient healthcare information and to support clinical decision making and problem solving. Demonstrate core, uh, demonstrate core, oh, sorry, professional values, accept and give constructive feedback, assume responsibility and accountability for professional behaviors through a debriefing exercise related to the clinical scenario. So now we're down to the case/situation and the debriefing questions. Um, I guess in a nutshell, just to refresh everybody, there was a surgery to be done on a young man's foot, and a long story short, the surgeon came in and marked the incorrect foot because he was kind of in a hurry. He was caught in traffic. He was late to work a little bit. He wanted to hurry up. So the mother had noticed that when he marked it, but decided to stay silent because she figured that the healthcare providers knew what they were doing. It was nothing to worry about. But anyways, the nurse wanted to conduct a timeout, and the doctor basically said, "Hey, I'm already late. Already marked the wrong foot. I'm sure it's the right one. So let's just not do that. Let's just go ahead and proceed with the procedure as planned." And they all said, "Okay, whatever." So he started operating on the incorrect foot, and once he noticed that the bony prominence was not there, quickly just realized that he had done the wrong foot. So he sutured it back up and started working on the other foot. So when it was time for the procedure to be over and for the young man to come off the anesthetic, the doctor or the surgeon told the CRNA to go ahead and use the to give him a antibiotic prophylactically, and it was supposed to help as a reversal agent for the anesthesia as well. And he reached in the drawer, didn't check the vial, and basically he administered ketamine instead of the Ancef that he was supposed to give instead. So because of that, it caused a severe respiratory depression in a patient that already had a history of asthma, and he had to remain intubated and admitted to the ICU. So, understandably, his parents were very concerned, and they didn't really receive a good explanation either, other than, quote, we paralyzed, I believe it said, we paralyzed his lungs and now are having trouble getting him to breathe on his own or something like that. In a
Mm-hmm.
nutshell, it's multiple sentinel events. It's not pretty. It's pretty ugly, and it just needed some disciplinary action as well as education and just make putting protocols in place to make sure something like this never happens again. So I think everyone can agree that certain steps needed to be followed and they were failed. And not only the healthcare providers failed, but the hospital has a responsibility as well. Um,
Mm-hmm.
but we'll get to that point in mind. And I'm sorry I'm talking so much. I'm just trying to get us going. But we'll get to where everyone else is involved as well. Okay, so with the whole story being said, we filled out the whole QEP project together. Rachel did the first part, I did the second part. Or I'm sorry, Train did the first part, I did this part two, and Rachel did part three. We all collaborated and did our parts accordingly. I felt like everyone contributed very nicely. Everyone's parts looked great. Well, I can't speak for mine because it's mine, but we all did our parts, and I guess we'll see how we did. And now we're going to be discussing these debriefing questions to see how our clinical experience was. So, with that being said, oh yeah, it says link to recorded Zoom, insert here. Okay, so when this is over, I'll insert the link if I can figure it out. If not, I'll be sure to embed the recording file. So, number one, error prevention. And I guess we'll just take turns answering these questions. We'll all give an input on each one. I think that's fair. And that'll be a good way that we all get our thoughts heard and processed. Does that sound good, guys?
Sure.
Yeah.
Okay. So, A, based on the medical error of improper surgical site marking, how could you use, how could you, as the perioperative nurse, have prevented this error? List specific strategies you would consider. Propose solutions to this error for the future. And discuss the pros and cons for each strategy. Okay, who would like to go first?
Um, I don't have time to think about it because this is my first time seeing the question, but um, I would just go ahead because I think this is part of my part also.
Okay.
Um, I think it's for peri-op, we need to review the patient document like a folder, the file, and the medical history, and also what is the reason for the surgery today. And looking at as I'm looking at the medical record, I also have to look at the feet as well to make sure that it's marked correctly. Let's see, strategy you would consider, and pretty much is that as a peri-op, and then verification, verify verbally, and documentation. And I think is after the surgeon do the sign marking, the circulating nurse is the one that verify that as well. So it's two persons, not just not just the doctor, the surgeon mark, and then it's done. Uh, I don't know if I answer on the question.
Oh, that's perfect. I think that's great. Um, okay, yeah, Rachel, do you want to go next or I can go next? It's whatever you'd like to do.
For B,
Yeah, we can do A or B. I'm not sure how much time it's going to take up. So, uh, I it
for the
depends on
second
whatever y'all
question.
want to do. Yeah, I
Yeah,
guess we could all give
I
an
can go to the
answer
next
unless we have
question. Yeah.
Okay.
Okay, what strategies did your group discuss as ways to prevent error related to the medication error? Propose solutions to this error for the future and discuss the pros and cons for each strategy. So I think the medication error, um, it goes along, I mean, goes along with all the issues that were with the surgical site error. Like nothing
Right.
is being verified with more than one person. And
Mm-hmm.
so whenever that happens, I mean, it's always, no matter what you do in nursing, it's when something's important, it's always better to have more than one set of eyes on it. But I
Yes, ma'am.
also think that's most likely policy for any type of pre-op operation.
Mm-hmm.
I've only been in surgical center for like one shift, honestly. So I don't know all the protocols, and it's probably different for hospital. But when it comes to medication error, we're following those six rights of medication, and they clearly were not followed. And there's just so many different steps that if they had gone with the simple things that we learn, like the basics of like nursing 101, then it wouldn't have happened.
Mm-hmm.
Um, so yeah, I think for the medication, what they reached into the back of the cart and just
Yeah.
assumed that that was the correct medication, which we can never do. We don't even do that when we pull meds from regular meds from our Pyxis machine. I mean, we always look at it. Um, and not only that, I think we read, the different policies are different for the hospital, but the main things for a pre-op and any surgical procedure is that things need to be, if they're, especially if they're pre-drawn, labeled right away, and it needs to be done with two nurses or verbally, like especially
Mm-hmm.
if they're, across the room, somebody needs to be able to verify so that those errors don't happen.
Absolutely.
So,
Absolutely. Yes, so to rehash on what y'all guys said, like Trang said, with the improper surgical site marking, it takes two to tango, definitely on that error because for one, the surgeon marked the wrong one, but the nurse didn't verify either. I felt like something that could have been changed, like as it says, different strategies we would consider to make sure this doesn't happen as far as the surgical site goes was when the surgeon abruptly stopped the timeout and said, "We're not doing this," I think even though he's the surgeon, he's supposed to be the head honcho or whatever. I really think that it's important to, as the nurse, to advocate for your patient, anyways, at the risk of upsetting the doctor or the surgeon, and making sure that timeout takes place, regardless of his feelings or anything, because
right.
it's
Right.
for the patient, it's the policy, and if he wants to get mad at you, that's fine. But at the end of the day, it's your license and your patient, and
Yes.
if he wants to put his license on the line, he can do it with somebody else's loved ones or somebody else's patient, or honestly shouldn't, but you know what I'm saying.
Hmm.
Um, so I think that yeah, the nurse probably should have. Hey, I'm sorry, we're not doing this. Like the backup, we're not doing this until you agree to the timeout. So you can either take an extra 5 minutes, or you're not doing the procedure, or we're not assisting. So
Right.
and go up chain of command and make sure things are taking place, even if the surgery has to get canceled for that day or whatever. As far as strategies to reduce for the medication error, yes, like you said, always visually identify, but also verbally. Like if anyone's ever been part of a procedure, the doctor says, "Okay, give me two of Versed." Like, "Oh, two of Versed in." You're like, "Okay," you know what I mean? You're not just pushing stuff and not saying nothing. That's not how we do things. Um, and as far as the Pyxis thing, how it got loaded incorrectly by the pharmacy tech or something like that, uh, on my part, on part two, it actually said I had to answer this question, and one of the strategies I recommended was maybe having a two, if the hospital financial department allows, to just have two techs or maybe a tech and an assistant present at all times to verify what they're loading um, into the Pyxis or into the CRNA's carts or anything like that when it comes to medications. Now,
Mhm.
obviously, it still falls on the CRNA, but at least there would be a two-person barrier to that mistake happening as opposed to or I guess a three-person barrier as opposed to a two if you had an extra person involved. So yeah, ready to go on to C, I guess. Oh, how would we implement? I think we already discussed how we would implement the strategies. Okay, are we all in
Yeah.
agreement with
Yes.
that? Okay, and then I guess on D, it's asking how would we evaluate the outcomes? How would you monitor and evaluate progress toward achieving the desired outcomes? How would you know the strategies you implemented were effective? And how would you know you need to revise your strategies? Would y'all like to answer, or I can answer something or chime in? as needed. I just don't want to take up all the speaking time.
I think honestly, I think a lot of hospitals do a lot of risk management, and so they're going to be looking at, um, what goes on in different procedures. And I know a lot of hospitals have like reliable little learning tools that if something like that does happen, they have to write stuff has to be written up. And so they can go and evaluate like, so this is what happened. How do we change it? And next time did we change it? And just see
Hmm.
what the outcomes are and, see the trends with
Yep.
certain surgeons and certain nurses and how change can be implemented because we know people make mistakes all the time. We know that people are rushed. We know that the hospital is always rushed, but are people following protocols so that things don't get lost so I think I think most hospitals, and if they don't, they should have those different surveys in place, the risk management team that can look and see um, what what have we done to make changes because this surgeon's doing this. We're having like, I mean, I know even at our hospital, we've had certain surgeons that have repeat admissions, because that
Hmm.
patient goes home. Um, and we don't have we because of that, we don't have those physicians anymore. Does that, you know what I'm saying? Like they've
Yes.
made changes because they've noticed a trend that things aren't being done properly and it really puts the patient at risk. And we even with patients that come into the emergency room or come up to like a critical care unit, um, we'll see trends with different facilities like outpatient procedures and outpatient surgeries where they're not following protocols and patients end up with huge hematomas and
Hmm.
sentinel events like this one because they're just rushing through things. It seems to be really careless. Simple things that could be implemented that
Hmm.
are easy, they're not doing. So I think, yeah, following trends and having those risk management teams kind of reevaluate and see if those outcomes improve is just, I don't know, one of the ways I suppose a hospital could do that. It just depends on who's aligned to do those things. But, upper management looks at it, but
Hmm.
they need to make sure that outcomes are improving for sure.
Yes, ma'am.
And I think is if it's a good hospital, I think they also have like a safe link where the employee can post like a question and also like report the incident that they witnessed, and that is anonymously. So they can also look into that and read the because sometimes they're not gonna coming out and talk about this doctor do this surgeon do that right in the face or name it out because they also there's some kind of like fifth one the job, but the safe link is where they can put it like I witnessed this, and then they can go to investigate it as well.
Yes, ma'am. Yes, ma'am. Yeah, I agree with both of y'all, wholeheartedly. I think it's really important to just analyze those statistics, and you have to change a factor or a variable somewhere in order to reach the desired outcome. If the outcomes you keep getting are these readmissions and these surgical complications, then one of the factors, maybe the surgeon or anybody, the circulator, it has to change. So, okay, wonderful, wonderful. Great intercourse with everybody. Okay. As far as safety, patient advocacy, and problem solving, this one says, how can you, as an individual leader at the bedside, as a manager, or as nurse executive, model the importance of quality safety through adhering to best practices? Okay. Um, yeah, I can go. Unless y'all would like to. I don't want to leave y'all hanging because I know that it's been hard to find the link's been hard to find to view this document. So I looked through it a little bit, so I'm a little bit more prepared if I can answer and y'all can chime in if you like. Okay, cool. So how can you as an individual leader model the importance of quality/safety through adhering to best practices? So in my opinion, I believe that it's important as a leader to lead by example. So there's a saying that says you have to practice what you preach. Because if you don't do that, then how are your employees or your coworkers going to do that as well? You can't hold your employees accountable if you can't be held accountable yourself. So it's one of those things where if there's certain quality and safety protocols, you have to adhere to those in front of your coworkers, or they're not going to either. So, in my opinion, as a leader, I think that's the best way that you can make sure that these things happen is to lead by example.
Yeah, I think so too. I think especially when we look at the different managers and like, where it says nurse executives, I mean, they have to continuously be reviewing hospital policy and making sure that they're following hospital policy. Um, I know for, like I said, I don't work a lot in surgery. Like I've only been down there one full shift, but there are other people there that like this is the head nurse here. She's in charge of this, and this person does this, and they all know their role. And then you have the person that has been there to assign them their role. As soon as they get into that operating unit, they're all assigned a room for surgery and, where they're going to go scrub up and everything. And that person is the one that they're all looking at. And so, yeah, they have to lead by example. They have to be the one that's following protocol and making sure that they're all following protocol too. Because, I mean, I know even just on a regular unit, like I look at my charge nurse all the time. I expect her to know exactly what to do in every situation, even though that's a
Hmm.
lot to ask, but that's just what we automatically do. And so they need to be aware of all the policies and they just need to be able to follow them, without
Absolutely.
question.
I agree with everything you said.
Wonderful.
We're
Sounds
all in
great.
We
agreement.
are good.
All in agreement. Okay, cool. Are you ready to move on to B, guys? And I'll give y'all
Yes.
a chance to answer too. I'm not going to steal everything. Um, how can you use this clinical group activity and apply what you learned to your own practice areas?
Mm. I I guess I'm go first on this question. I think is the clinical group activity is very helpful. I get to hear more opinion from everybody because everyone think differently. But the common goal is that we have patient safety policy procedure. We don't cut short to get it done quickly. But there's sometimes around that how you manage this, how you manage that, that kind of like helpful. Um,
Hmm.
and then how to learn to your own practice area. I think ultimate goal is did I do my best and do it right for this patient? And that is my goal right there.
Absolutely. Absolutely. As far as like something that you can apply to our own practice areas, I think we can learn some valuable lessons from this whole situation. Um, I guess from the outside looking in, it looks like how can these things possibly happen? But I guess if it can be made up, it's happened at some point, or we wouldn't have these policies or procedures. So they usually say that all these safety protocols for any workplace, not just the hospital, but like uh, construction environments, any or manufacturing, every health policy or safety policy is written in blood. It's because it's happened before. So that's one of those things that we have to adhere to and follow. But something we can apply to in your own practice areas. Obviously, we're going to be checking our medication bottles. We're going to be doing our timeouts. We're going to be making sure that
Yeah.
the surgeon is doing what they're supposed to do. As far as marking, we're going to be uh, not second guessing them, but re-identifying the surgical side as well. Okay,
Yeah.
we all cool on that front?
Yeah.
All right. How we use information in your professional nursing practice to improve consumer care. I think
Mm.
doing all the above that we just mentioned would improve consumer care drastically as opposed to the Sentinel events that took place during the project. Do y'all agree on that one?
Yes, yes.
Wonderful, wonderful. D, how will we use the critical appraisal and problem solving to work through future real world problems as a professional nurse? I think it's important to go through like chain of command. That's one of those things that you have to follow. So even if you don't feel comfortable speaking up or stopping someone who has authority over you, there's still a chain of command. Like Trang mentioned earlier, there's always an outlet for us to do something, even from our position.
Yeah, and
I
Um,
think,
like what Trang was saying earlier about like um there's every hospital has those ways that you can speak up and it can be
Stabling.
anonymous. Like that's
Absolutely.
we call them RLs at our hospital, reliable learning tool.
Okay.
And you can put it in on a person, you can put it on a housekeeping. If you find
Yeah.
literally one day I found a pillow that had blood on it and it was in a completely clean, sanitized room. And I'm like, this room has not been cleaned. That's just yuck,
Yeah.
So, but
Yeah.
it
Yeah.
happens. And it isn't that we're trying to point fingers at somebody because we all do things and we miss a step, but it's so that it doesn't happen again. So I can guarantee housekeeping never left a bloody pillow anywhere ever again. And
Mm-hmm.
they probably felt terrible. So it's like
Yeah.
those viable
Yeah.
learning tools, like you input it, it's not trying to attack somebody, although sometimes I think it is, but it's not trying to attack somebody. It's really a tool so that it doesn't happen again. And I
Absolutely.
think that's what's important too.
Yes. When it's
Yeah.
used appropriately, it's very good. Sorry. Go
I
ahead,
think
Train.
it's like each one of us is like working hard for it to work to this point. So when you coming out to work, is your name behind it, on your license and everything behind it. So sometimes like we see it, we say it. If not, then it's gonna affect us and our license to it.
Yeah,
Absolutely.
exactly.
Absolutely. Cool. Are we ready to go on to E, guys? The final one of part two?
Yes.
Yes.
Okay. In this case scenario, what was the most important takeaway you discovered in analyzing and resolving the medical issues through problem solving? Okay, guys, what was y'all's greatest takeaway after reviewing this story?
Double check your medication.
Yeah,
Don't give don't give
absolutely.
the wrong medication. Double check what the surgical site. I mean,
Especially
good
the
grief. Like
CRNA,
how do
man.
we
Oh
how do
man.
we really do that where we operate on the wrong foot? But it
Oh, that's
happens,
crazy.
But yeah, just like verify, verify, verify.
Yeah.
Yeah.
And I think it's like it's hard to do for a novice nurse, like a new nurse, but I
Mhm.
think it's like won't let other rush and push you because
Right.
sometimes they to rush, even nurse or even tech or doctor, and don't let them just to get you nervous and panic.
Absolutely. Absolutely. Um, yeah, y'all guys hit it on the nail. I think y'all guys said it greatly. I guess my most important takeaway was just to trust but verify your coworkers and follow the appropriate protocols. And you just can't get complacent. I mean, that CRNA is probably hung 1,000 prophylactic uh, ANSEF injections in his whole life or bags in his
Yeah,
entire life.
right,
So
right.
he just got complacent. The millionth and first time is all it takes to something bad like this to happen. So it's important to go through all of your protocols and procedures, just like it's your first day in nursing school. Follow your 5 rights, do your timeouts, don't get in a rush, just do the right thing. We'd
Mhm.
rather the doctor go home 30 minutes late later that day than something like this happen. That's just part of it. That's the field we decided to be a part of, and it's not perfect. Okay, everybody agree?
Yeah.
Yes.
Okay, so part number three is reflection. Uh-oh. No, don't do this to me. Please don't do this to me. Okay, we have 10 minutes left on the meeting. Thank goodness.
Okay.
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 Woo, man. Okay, it told me to upgrade and it's now gave me a 10-minute timer, so we're good. Hopefully.
Okay, we can do it.
Oh man, that scared me. Okay. Anyways, reflection on leader follower roles and activity overall. So I believe this section isn't so much about the case scenario, it's just about our group in general and how we feel we improved, we exceeded, maybe fell short on different things, and I guess we get to air our feelings about our roles and how we collaborate, stuff like that. Okay. So number A or letter A says, how did this clinical activity improve your leadership and followership roles? So would y'all like to go first, or me, or would y'all like?
Let's save time. We only have 10 minutes.
Okay.
I think we did good. I don't think it's necessary has to have something error or something is a big improve. You leader, you get everything organized and everybody do our own part and we put together, we do what is asked for. So
Mm-hmm.
I don't think anything more for improvement unless you guys see something.
No.
No, no.
No. I
I think
think,
everything,
yeah.
like even when we went together to do the other group assignment, the team building and everything seemed really slick for me. Honestly, like
Hmm.
everything was collaborated really well. Kellen put everything together and told us exactly what we needed to do, and we just did it, you know?
Yeah.
Yep, we took it out. I feel like it was divide and conquer, and everybody contributed equally, and it was great. It was a good experience. So, did you see a change from being a group member to becoming a team through communication and collaboration on this clinical activity over time? Yeah, I think we became a team. I feel like I'm friends with y'all guys, so that works for me.
Absolutely.
Awesome. Yes.
Okay, great. I think we had great correspondence via text message. That was probably our quickest way to get with each other. Anytime we needed something or needed a question answered, not even for just the project, but for the course in general. Everybody helped each other out and had each other's backs, and I think that's basically the embodiment of what you'd call a team. So
Yeah.
it's been a great time. So letter C, what did you struggle with the most during this activity? What was the most beneficial takeaway from this activity? Um, for me personally, I need to work on something. I need to work on all of nursing school, and my professors have told me every time is I need to learn how to rely on others and ask for help because sometimes my pride can get in the way, and I just want to do and handle it all myself. But I need to rely on others more, and that's something that I had to learn during this project. And my partners had my back and took care of business, so it was great. And that was my great takeaway from this assignment. So I'll let y'all guys answer now.
For struggle for me is always the technology. I mean, always, even just pulling up a Word document, Google document. I know that sounds silly, but that's something where I always struggle. But I mean, everything that Kellen emailed, I was able to open. So I was like, thank you, Jesus, I can open it. But that's always where I find that I struggle, and I think it just makes me show my age really is what happens. But but I felt like that was always my biggest concern. But really what I found um most from trying to coordinate with the group was just finding time because we're all so busy.
Yeah.
We can't help it. I still don't know how Kellen is in school getting his ADN and getting his concurrent bachelor's, and you must
Yeah.
be going to schools too. Like
Oh yeah. Well,
that just kills.
I don't want to brag, but I also work as an extern 3 days a week at
That's
UT
right.
Health.
That's right. You
Yeah.
work as an
Yeah.
extern. I mean, I worked as full time as a tech all through
Hmm.
nursing school, but I
Yes,
could
ma'am.
not have done concurrent BSN. I know for a fact I could not have done concurrent BSN. So
Y'all
I
could.
think
Y'all
that
could.
I have like I've had to do a lot of good time management. I mean, we do have a house full of kids. That's a whole nother
Hmm.
story. But at the same time, I time management, like I just had to really learn, especially when by the time this course became accessed, we were able to access everything. We were down to how many weeks, you know what I'm saying? So
Yes,
so
ma'am.
I think actually I think we all really stayed really flexible with each other. I think that was really key. And, like, I mean, I'm super tired. We're all tired,
Yes.
but this was the best time to do it. I mean, what do we do? I mean,
Yes,
what else
ma'am.
can we do?
Yeah,
Yeah.
I'm glad we got a time work it out. So that's great.
Yes.
So I think it's my answer for a C is also an
Hmm.
answer for a D because
Yeah.
my struggle is for this case is that I cannot put in my head and imagine the scenario in the OR.
Hmm.
I've been there with the C-section a few times, but I want to know like what CRNA actually doing
Hmm.
and stuff like that. So that's kind of like my struggle in the beginning. But once I get that down, which is that my problem solving this complex case, is that the strength is that I have a few friends work in the OR. So I actually interview them.
Nice. Nice. Well, it worked out then. Worked
So,
out perfect.
so it worked out because I have to understand how.
How this happens.
Yes. So I talk about the case and I thought about my thinking behind that. And then I got to interview what are they doing and stuff like that. So that's kind of like C and D together. The beneficial takeaway from this activity is that I get a better knowledge in the OR. It's actually fascinating when I hear them talking about it. And I was thinking, oh,
Hmm.
I want to work in the OR.
Yeah.
So anyway, so that's my CD answer.
There we go.
Wonderful. Wonderful. Yeah, like Trang said, on D, what were the strengths in problem solving complex? Yeah, Trang showed her strength in the problem solving in this case, in this complex case scenario. As far as I guess my answer for D, what were your strengths? And I think that we were all three of us could say that we immediately realized what went wrong and how it could have been changed and how these things can be prevented. So I think that was our strength, at least for me. Would you agree, Rachel?
Yeah, yeah, I agree.
Okay, cool. Well, it looks like all the questions. Thank y'all guys for being here. And I'm gonna stop the recording here in a second unless y'all have anything else to add.
We did
Yeah,
it.
I
Don't
don't
have
think
All
so.
right,
anything to add.
let me go back to this. One moment. Okay, back to screen. And then okay, I'm gonna stop the recording now. Um, one sec.